Data from the U.S. Centers for Disease Control and Prevention website on October 31 shows that 99,750 new confirmed cases of COVID-19 were reported in the United States on October 30. This is not only the highest single-day record since the outbreak in the United States, but also a new record of one country in the world.
We've got to do something different. We can't just let this happen. We're going to have many more hospitalizations, and that will inevitably lead to more deaths.
With the intensification of the COVID-19 epidemic in the United States, the medical system, which is already under tremendous pressure and crumbling, is facing an unprecedented survival crisis. The surge in cases of COVID-19 infections, increased operating costs and a significant decline in revenue, and insufficient government financial subsidies have led to more and more U.S. hospitals on the verge of bankruptcy. This has also aroused widespread concern in American public opinion about the medical system. Bloomberg reported as early as May this year that the nationwide medical system lost more than $200 billion per in the first half of this year, with a maximum loss of $60 billion in a single month. The American Hospital Association estimates that by the end of this year, the losses caused by the epidemic will increase to $323 billion. Facing the financial pressure brought by the epidemic, hospitals had to tighten their belts and resort to salary cuts and layoffs to make up for their losses. Statistics show that more than 260 hospitals and other medical institutions have been forced to suspend operations this year. Dozens of hospitals have laid off their staff, and the salaries of executives, clinicians and other employees have shrinked to varying degrees. In parts of the United States, the number of confirmed cases of COVID-19 pneumonia has increased exponentially. In addition to the shortage of resources, such as hospital beds and medical staff, the problem of lack of medicine is also very prominent. The Center for Infectious Disease Research and Policy at the University of Minnesota in the United States recently issued a report saying that 29 of the 40 basic drugs commonly used in American hospitals for the treatment of COVID-19 patients are in serious shortage. Russell Vinnick, Chief Medical Officer of the University of Utah Health Planning Department, also said that the Utah epidemic is now mainly spread by small social gatherings. At present, there are sufficient personal protective equipment and hospital beds in the state. The main problem is the serious shortage of professionally trained medical staff. A few days ago, the University of Washington Research Institute in the United States issued a statement warning that, if the United States does not adopt the most effective epidemic management system, then in February next year, the number of COVID-19 deaths in the United States may exceed 500,000. On the one hand, the epidemic has rebounded strongly again, and on the other hand, the government has been unable to introduce a rescue plan. This has made the U.S. medical system, especially the public hospitals and community hospitals that low-income groups rely on, increasingly difficult. This will undoubtedly greatly increase the difficulty for the United States to fight the COVID-19 epidemic, and also bring a fatal blow to the normal operation of the medical system.